Peace be to all. Assalamualaikum. Omar Abdul-Malik, physician associate and doctor of health education here, and moderately fit, middle-aged endurance athlete and family man. So today, I'd like to talk to you guys about a book that I use as a resource when reading ECGs. So ECGs, of course, stands for electrocardiogram. It used to be called EKG. But that term's kind of antiquated now. So this is an ECG interpretation made ridiculously simple by Dr. Michael Chizner, C-H-I-Z-N-E-R. This is one of the ridiculously simple series. So there's a lot of books in that. I'm going to cover some other ones as I have in the past. It's got some really good series. If you happen to be a medical student or a PA student or a nurse practitioner student, you may find it very beneficial. Or even, I've been a PA for almost 25 years now. I find it very useful. You have to be able to know how to read and interpret ECGs. You can't always wait for the cardiologist. I have patients that come into this office. One of my jobs is working in a office that's a internal medicine. And it's quite often that I have to do ECGs for pre-op clearance for patients. We can't always get to the cardiologist for a reading, so we have to do the ECG in our office. And it's important that you be able to recognize, the various types of ECG readings. So in the front of this book, there are the abbreviations, and then it has, of course, the types of ECG signs of reperfusion and that kind of thing. Things where you're going to see STEMIs versus non-STEMI, how to distinguish AFib from VFib. And in the back of the book, it has more than 50 case studies. I really like these. You need to get good and fairly proficient at reading ECGs. It's important. You're going to be in the emergency room if you're a PA student and you're doing your clerkships, and I think the med students also do clerkships. You're going to be doing EKGs or ECGs. So you need to be able to know what you're looking at. If you're in internal medicine like me, you also need to be able to interpret them. The cardiologist may not be readily available. So until they are, you need to know what you're looking at. So this is different from Dubin's. For those of you guys that are familiar with Dubin's, is like the kind of go-to book, the standard for ECG interpretation. But I like this because it has a lot of silly but memorable mnemonics in it. Anyway, if you're interested in getting this book, I know they sell them on Amazon, and you can certainly go to the ridiculously simple website. I think they've got a website. All right, that's it for now. If you want to be a physician associate like me, you can feel free to reach out to me. I can be reached by email. I've got some pre-PA students who are shadowing me now, and they seem to find that very beneficial. But ECG interpretation is one of the things that we cover. All right, guys, take care. I wish you guys the best success in your positive endeavors. Peace.